Hello, everyone. I'm Megan McGurman.
And I'm Jason Tokarski. Welcome to another episode of For the Love of Health, brought to you by ChristianaCare.
'Tis the season to be sick. And as we say goodbye to 2024, we want to avoid saying hello to respiratory illness.
So we've brought in Dr. Marci Drees, ChristianaCare's Chief Infection Prevention Officer, to help us stay healthy for the holidays.
Marci, thank you so much for being here today.
Thanks very much for having me.
Over the years, we've talked about the triple-demic, flu, COVID, RSV. Now there's whooping cough in the headlines, walking pneumonia in the headlines. Where are we with all of these infectious diseases going into 2025?
We're clearly in respiratory season now, right? Usually things start to ramp up October, November-ish. If you remember, during COVID, when everything was locked down, everyone was masking, there was almost no other respiratory disease out there. And then once we started to open things back up, we had very early seasons for flu and RSV. We've really started to shift now back to more the normal seasonality. The good thing is they don't tend to all peak at the same time. So we really are seeing the first one is RSV is definitely on its way up. I don't think it's peaked yet, but it's kind of sooner than the other ones. And then COVID would be our next most common infection that we see, followed by flu. So they're all on the rise, just at different rates at this point. What we're also seeing an increase now is bacteria. And the same thing happened with those, that we saw very little of them during COVID when everything was shut down, and they're really resurging with a vengeance, so to speak. So when we think about walking pneumonia, so first of all, pneumonia is obviously a lung infection deep in the body, compared to most cases of flu and COVID will mostly affect your upper respiratory symptom, upper respiratory tract. So pneumonia, of course, is typically more severe, usually caused by bacteria, though not always, and often it lands people in the hospital to get IV antibiotics and other things. When we talk about walking pneumonia, it's just a less severe type of pneumonia, where people normally are walking around, right? They're not usually hospitalized, although it can happen. And it's a number of different organisms that can cause walking pneumonia. It's kind of a generic term. But the one that we're most worried about now is Mycoplasma pneumoniae. So we've seen a large increase this year compared to last. And what's really new about this year is that it's being seen in that 2 to 4 year old range, which normally it affects older children and adults. And how do you tell the difference? Well, typically, it comes on very gradually and lasts for weeks at a time. So, whereas a typical flu or COVID or just common cold will usually kind of peak within a week or so. You may last a little bit longer, but you're clearly on the mend. Whereas this will continue to get worse over a couple weeks. The good thing is there are antibiotics for it, but it's not necessarily the same antibiotic that you would give for your average ear infection. So there needs to be some suspicion that this is more than just kind of your run-of-the-mill ear infection. There is testing for it. It's not readily available in the outpatient setting. Certainly we test for it if people are sick enough to be hospitalized. It's a little bit less available outside just because it's a pretty expensive test.
What about whooping cough?
Yeah, so whooping cough, also known as pertussis, it gets its name from the whoop that can happen as people are trying to catch their breath in between coughs, but you don't have to have that. It's also called the 100-day cough. Which kind of gives you a sense that this can last a really long time. I had a friend who actually break a rib from coughing so hard. It's a very severe cough. We're seeing 6 times as many cases as we did last year. It is a reportable disease. Even that is certainly an underestimate because not everybody with pertussis gets tested. Again, it's not a readily available test that you can just get at the drugstore, or even from most primary care offices aren't necessarily going to test for it. They'll just treat empirically. The good thing is there is a vaccine, unlike for Mycoplasma. Kids get 5 doses up to the age of 6, and then a booster starting at age 11. And so kids are actually pretty well protected against whooping cough, but it's when that later adolescence, early adulthood, when that immunity has worn off, is when people start to be susceptible again. The vaccine is the combined vaccine between tetanus, diphtheria, and pertussis. It's required every 10 years, or it's recommended every 10 years for tetanus. The pertussis immunity wears off a little bit quicker than that, unfortunately. But so if you haven't had what's called a Tdap in the last 10 years, I definitely would go out and get one. Pregnant women get it every pregnancy, again, to protect the newborn who can't be vaccinated yet. And if you're a caretaker, a grandparent, a teacher, a daycare worker, anyone who's around young kids really should get that Tdap and get it on a fairly regular basis.
So we've got Christmas, Hanukkah, and Kwanzaa all hitting basically at the exact same time. So lots of people getting together for get-togethers and parties and such. Do you have any advice on how people might be able to get through all this so that the only thing they come home with is the gifts and the food that they were supposed to?
Well, I mean, it is the perfect time of year to spread viruses and bacteria to each other, right? These are all spread via respiratory means, coughing, sneezing, touching things with your hands that aren't clean. So the best you can do with your respiratory etiquette, using a tissue or your elbow, not your hands, washing your hands frequently, wiping down surfaces frequently. A lot of people are traveling. So if you are visiting loved ones, especially if they're elderly or they're young babies, you have to be especially careful. Make sure, of course, that you're up to date on all your vaccines that you're eligible for. If you're flying, I would certainly consider masking in the airport or in the plane, at least until they get the air running in the plane. If you're sitting at the gate, they're not running the air circulation. So that's a high-risk time. Of course, none of that's going to protect you if someone who's sick is right next to you. But if you notice that, then I would probably mask the whole time that you're in the plane.
Is it too late at this point for somebody who wants to get one of the vaccinations, be it for flu, COVID, RSV, what have you?
Absolutely not. So we will continue vaccinating for flu really up until the end of March, even though usually by then flu is kind of come and gone. But not infrequently, we'll see a late surge in flu B. So that's why we continue to do that. Now is really the perfect time. It's not going to protect you tomorrow or the next day. It normally takes about 2 weeks for any of these vaccines to show protection. Even if you've already had the flu, I would still get vaccinated because you might get a different strain of the flu. If you've had COVID recently, I would wait 3 months to get that vaccine because that will maximize your immunity. But no, it's definitely not too late.
But it is as far as covering you with the vaccines for the holidays. If it's a 2-week thing like you're talking about there, you've kind of already missed that window as far as the holidays are concerned?
Well, I mean, I would not wait until after the holidays for sure, because you never know at what point you might get exposed. And if you're going to go somewhere for a week, you might start to see some protection by the end of that week if you were to get vaccinated today.
And anyone 6 months or older can get the COVID vaccine and the flu vaccine, but RSV has some specific guidelines.
Yeah, so RSV is our newest kid on the block. This will be the second RSV season. It's really intended for older adults and pregnant women, the vaccine. So to talk about older adults, it used to be anyone over 60 could kind of consider getting it. They just changed the guidelines this spring to say that everybody over 75 or older should get that RSV vaccine because they're at very high risk of severe RSV should they get infected. But then if you're between 60 and 74, it really depends on whether you have other conditions, diabetes with end organ failure like kidney disease or neuropathy, end-stage kidney disease, and there's a whole host of other ones that are on the website. Now, for RSV, really the highest risk group are newborns. They far and away are most likely to be hospitalized with severe RSV, be on a ventilator, and even die from RSV. So we have two strategies now to protect those newborns. One is that mom can get vaccinated toward the end of her pregnancy, so she has time to develop antibodies that she can pass directly to the baby and also through breastfeeding if she breastfeeds. And then the second option is to give the baby what's called a monoclonal antibody. It's given as soon as possible after birth, within the first week ideally, and that gives them kind of the direct antibodies to protect them.
Bit of a personal question. Going past the holidays, I am in full worried about the daycare and preschool germs mode as a parent of 2 young little guys. What is your advice to the parents in a similar boat that no matter what, they know those germs are going to come home?
Yeah, it's really hard because you have limited control over what happens in the daycare. Obviously, you want to make sure that you talk to your daycare providers, that they're cleaning toys regularly. They're maybe not using toys that you can't clean, like stuffed animals. Certainly, they should have policies around when children need to be excluded from daycare so that other parents aren't bringing their sick kids and dropping them off. You can't exclude a kid every time they have a runny nose, of course. So some of those germs are still going to come home. And certainly, if you have more than one child at home, then cleaning your toys, maybe not having the kids play with the same toys if that's possible. It may not be. Putting those stuffed animals away until after kind of the viruses die down a little bit. Those are things you can try. And then just cleaning. You can't get them to cover their cough most of the time, but the best you can try.
And do you recommend kind of a nightly cleaning of all of the Little People toys and the Paw Patrol figurines and all the things that are kind of in that heavily play rotation?
Yeah, if they've been played with, they probably should be cleaned, at least by the end of the day. And maybe, have a rotation of your toys. You're not cleaning every toy every day.
You mentioned making sure that the extra little guys, the newborns, the infants, are kind of extra protected, especially with RSV and everything else going around. what if, and this is a very personal question, you have both at home, a kind of toddler with a lot of preschool germs and then a 3-month-old, say?
Again, that 3-month-old cannot really be vaccinated themselves, but hopefully, you were vaccinated.
Got the RSV, yep.
Or they got the monoclonal antibody for RSV. And the older child hopefully can be vaccinated against those at least. Obviously, we don't have a vaccine for every germ that's out there, but staying up to date on the ones we do have will certainly help. And they want to be loving on each other, and that's normal. And you don't want to necessarily discourage that, of course. But just washing hands before the older one touches the baby. Obviously, if the older one is coughing a lot, you might want to not have them cough right on the baby, sort of thing.
One of those easier said than done things, for sure. Yeah,
exactly. I no longer have young children, so I don't have to worry about it. But I empathize absolutely.
Marci, you and I have had these types of conversations many times over the years. I remember during COVID, it was wear your mask, take a test before you go anywhere. What are your recommendations now for the 2024 holiday season?
Well, I think people are kind of over masking, and I understand people aren't going to continue to mask when they're around even loved ones that they haven't seen in a while. But certainly if you feel ill, it's hard to do, but I would really consider not traveling, right? Even if it, requires canceling a last minute flight or disappointing your relatives, you will disappoint them even more if you give them COVID or give them flu. So that would be one thing that I would really be conscious of. Obviously, COVID tests are readily available over the counter. There are some over-the-counter flu tests that cost a little bit more, but they're affordable. And certainly you can go to your doctor and get tested for flu or COVID as well. So I would just be really conscious about your own health and have a low threshold to test and potentially delay your travel if anyone in your party is ill. Of course, as we said before, all the respiratory hygiene, the hand hygiene, and that's for if you don't feel sick. You still need to do all those things, certainly before you prepare any food. But just, whenever you're in close contact with people, just make sure, things that you're sharing like phones or, any high touch objects get cleaned off on a regular basis.
Marci, thank you so much for your time.
You're very welcome.
From all of us here at For the Love of Health, we wish you a happy and healthy holiday.
We'll be back in 2 weeks with another great conversation.
Until then, thanks for joining us for the Love of Health.